patient with Parkinson's disease is receiving care. What teaching points should the nurse include? Take medications as prescribed. Engage in regular physical exercise. Monitor for changes in swallowing. Increase dairy consumption. Taking medications, engaging in regular physical exercise, and monitoring for changes in swallowing help manage Parkinson's disease. A patient with hyperlipidemia is asking about lifestyle changes. What should the nurse recommend? Follow a low-fat, low-cholesterol diet. Engage in regular aerobic exercise. Take statins as prescribed. Increase intake of saturated fats. Following a low-fat, low-cholesterol diet, engaging in regular aerobic exercise, and taking statins as prescribed help manage hyperlipidemia. A patient with tuberculosis is receiving treatment. What interventions should the nurse implement? Follow the prescribed medication regimen. Practice respiratory hygiene, for example, covering mouth when coughing. Isolate at home if necessary. Increase physical contact with others. Following the medication regimen, practicing respiratory hygiene, and isolating if necessary help manage tuberculosis and prevent transmission. A patient with kidney stones is being treated. What instructions should the nurse include? Increase fluid intake. Follow dietary recommendations based on stone type. Monitor for signs of urinary tract infections. Avoid calcium supplements. Increasing fluid intake, following dietary recommendations, and monitoring for signs of urinary tract infections help manage kidney stones. A patient with hypothyroidism is being discharged. What teaching points should the nurse provide? Take prescribed thyroid hormone replacement, monitor for signs of improvement. Avoid foods high in fiber when taking medication, increase iodine intake. Taking thyroid hormone replacement, monitoring for improvement, and avoiding high-fiber foods when taking medication help manage hypothyroidism. A patient with ulcerative colitis is receiving care. What dietary instructions should the nurse recommend? Follow a low-fiber diet during flare-ups. Avoid spicy foods, monitor for signs of dehydration. Increase intake of caffeine. Following a low-fiber diet during flare-ups, avoiding spicy foods, and monitoring for dehydration help manage ulcerative colitis symptoms. A patient with rheumatoid arthritis is being treated. What interventions should the nurse implement? Engage in regular, gentle exercise. Take prescribed disease-modifying anti-rheumatic drugs DMARD-IS. Use heat or cold therapy as needed. Avoid periods of rest during the day. Engaging in regular, gentle exercise, taking DMARD-IS, and using heat or cold therapy help manage rheumatoid arthritis. Rest periods may be needed. A patient with sickle cell anemia is receiving care. What instructions should the nurse provide? Avoid high altitudes, stay hydrated. Avoid extreme temperatures. Take anticoagulants as prescribed. Avoiding high altitudes, staying hydrated, and avoiding extreme temperatures help manage sickle cell anemia and prevent crises. A patient with psoriasis is asking about management options. What should the nurse recommend? Apply topical corticosteroids as prescribed. Keep the skin moisturized. Avoid triggers such as stress or injury. Engage in hot baths. Applying topical corticosteroids, keeping the skin moisturized, and avoiding triggers help manage psoriasis symptoms. A patient undergoing chemotherapy for lymphoma is experiencing nausea. What interventions should the nurse recommend? Administer antiemetics as prescribed. Encourage small, frequent meals. Avoid strong odors and scents. Increase intake of fatty foods. Administering antiemetics, encouraging small meals, and avoiding strong odors help manage chemotherapy-induced nausea. A patient with multiple sclerosis is being discharged. What instructions should the nurse include? Avoid heat exposure. Engage in regular exercise. Follow a high-fat diet. Monitor for changes in mobility. Avoiding heat exposure, engaging in regular exercise, and monitoring mobility changes help manage multiple sclerosis symptoms. A patient with atrial fibrillation is being instructed on self-management. What should the nurse recommend? Monitor pulse regularly, avoid alcohol and caffeine. Take anticoagulants as prescribed, increase sodium intake. Monitoring pulse, avoiding alcohol and caffeine, and taking anticoagulants help manage atrial fibrillation. Sodium intake should be controlled. A patient with obstructive sleep apnea (OSA) is being treated. What interventions should the nurse implement? Use continuous positive airway pressure (CPAP) as prescribed. Avoid alcohol and sedatives. Sleep on the back. Maintain a healthy weight. Using CPAP, avoiding alcohol and sedatives, and maintaining a healthy weight help manage OSA. Sleeping on the back can worsen OSA. A patient with chronic kidney disease (CKD) is receiving dietary instructions. What should the nurse include? Monitor protein intake. Follow a low-potassium diet. Avoid high-phosphorus foods. Increase sodium intake. Monitoring protein intake, following a low-potassium diet, and avoiding high-phosphorus foods help manage CKD. Sodium intake should be controlled. A patient with hyperthyroidism is being treated. What teaching points should the nurse provide? Monitor for signs of weight loss. Avoid caffeine. Use medications as prescribed. Increase iodine intake. Monitoring for weight loss, avoiding caffeine, and using medications help manage hyperthyroidism. Increasing iodine intake should be avoided. A patient with peptic ulcer disease PUD is asking about symptom management. What should the nurse recommend? Avoid NSAIDs and aspirin. Limit alcohol consumption. Use antacids as prescribed. Increase spicy food intake. Avoiding NSAIDs and aspirin, limiting alcohol consumption, and using antacids help manage PUD symptoms. A patient with osteoporosis is receiving treatment. What interventions should the nurse recommend? Increase calcium and vitamin D intake. Engage in weight-bearing exercise. Avoid smoking and excessive alcohol. Maintain a sedentary lifestyle. Increasing calcium and vitamin D, engaging in weight-bearing exercise, and avoiding smoking and excessive alcohol help manage osteoporosis. A sedentary lifestyle should be avoided. A patient with anemia is receiving care. What teaching points should the nurse include? Monitor hemoglobin and hematocrit levels. Consume iron-rich foods. Take iron supplements as prescribed. Avoid high-fiber foods. monitoring hemoglobin and hematocrit, consuming iron-rich foods, and taking iron supplements help manage anemia. High-fiber foods do not need to be avoided. A patient with shingles is receiving treatment. What interventions should the nurse recommend? Use cool compresses on affected areas. Administer antiviral medications as prescribed. Avoid close contact with others. Use warm, moist dressings. Using cool compresses, administering antiviral medications, and avoiding close contact help manage shingles and prevent transmission. Warm, moist dressings should be avoided. A patient undergoing chemotherapy for lung cancer is experiencing mouth sores. What interventions should the nurse implement? Use mouth rinses as prescribed. Avoid acidic or spicy foods. Keep the mouth clean and moist. Encourage smoking cessation. Using mouth rinses, avoiding acidic or spicy foods, keeping the mouth clean and moist, and encouraging smoking cessation help manage chemotherapy-induced mouth sores. A patient with epilepsy is being discharged. What instructions should the nurse include? Take prescribed anticonvulsant medications. Avoid alcohol consumption. Keep a seizure diary. Engage in dangerous activities. Taking anticonvulsant medications, avoiding alcohol, and keeping a seizure diary help manage epilepsy. A patient with heart failure is receiving education. What interventions should the nurse recommend? Follow a low-sodium diet, monitor daily weight. Increase fluid intake. Avoid smoking. Following a low-sodium diet, monitoring daily weight, and avoiding smoking help manage heart failure. Fluid intake may need to be restricted. A patient with asthma is being instructed on managing symptoms. What should the nurse recommend? Identify and avoid asthma triggers. Use rescue inhalers as prescribed. Avoid regular exercise. Practice breathing exercises. Identifying triggers using rescue inhalers and practicing breathing exercises can help manage asthma. Regular exercise can be beneficial if not a trigger. A patient with acute kidney injury AKI is being treated. What interventions should the nurse implement? Administer intravenous fluids as prescribed. Monitor intake and output. Encourage a high-protein diet. Monitor serum electrolyte levels. Administering fluids, monitoring intake and output, and monitoring electrolytes help manage AKI. A high-protein diet may need to be restricted. A patient with type 1 diabetes is being instructed on self-management. What should the nurse recommend? Monitor blood glucose levels regularly. Administer insulin as prescribed. Limit physical activity. Carry fast-acting carbohydrates. monitoring glucose, administering insulin, and carrying fast-acting carbohydrates help manage type 1 diabetes. Physical activity should be balanced, not limited. A patient with irritable bowel syndrome (IBS) is receiving dietary instructions. What should the nurse include? Increase fiber intake gradually. Avoid high-fat foods, reduce intake of caffeine. Increase consumption of dairy products. Increasing fiber gradually, avoiding high-fat foods, and reducing caffeine intake can help manage IBS symptoms. Dairy products may need to be limited for some individuals. A patient with osteoarthritis is asking about symptom management. What should the nurse recommend? Maintain a healthy weight. Engage in low-impact exercise. Apply heat or cold therapy as needed. Use NSAIDs for pain relief. Maintaining a healthy weight, engaging in low-impact exercise, applying heat or cold therapy, and using NSAIDs can help manage osteoarthritis symptoms. A patient with thrombocytopenia is receiving care. What precautions should the nurse recommend? Avoid aspirin and NSAIDs. Monitor for signs of bleeding. Avoid contact sports. Use a firm toothbrush. Avoiding aspirin and NSAIDs, monitoring for bleeding, and avoiding contact sports help manage thrombocytopenia and prevent complications. A soft toothbrush is recommended. A patient with acne is asking about management options. What should the nurse recommend? Wash the face with a gentle cleanser. Avoid touching the face frequently. Use non-comedogenic skin products. Increase consumption of high glycemic foods. Washing the face with a gentle cleanser, avoiding frequent face touching, and using non-comedogenic products help manage acne. A patient undergoing radiation therapy for breast cancer is experiencing skin changes. What should the nurse recommend? Use a mild soap and water to clean the area. Avoid tight-fitting clothing. Apply thick lotions or creams. Avoid exposing the area to direct sunlight. Using mild soap and water, avoiding tight-fitting clothing, and avoiding direct sunlight exposure can help manage skin changes due to radiation therapy. A patient with hypertension is being instructed on lifestyle changes. What should the nurse recommend? Increase salt intake. Engage in regular physical activity. Consume a low-fat diet. Monitor blood pressure regularly. Regular physical activity, a low-fat diet, and monitoring blood pressure can help manage hypertension. Salt intake should be decreased. A patient with a concussion is being observed. What interventions should the nurse implement? Keep the head of the bed flat. Monitor neurological status regularly. Avoid pain medications that can mask symptoms. Provide cognitive rest. Monitoring neurological status and providing cognitive rest help manage a concussion and prevent complications. A patient with chronic obstructive pulmonary disease (COPD) is being discharged. What instructions should the nurse include? Avoid large meals. Engage in regular exercise. Use oxygen therapy as prescribed. Stay hydrated. Avoiding large meals, using oxygen therapy, and staying hydrated help manage COPD symptoms. A patient with nephrotic syndrome is being cared for. What teaching points should the nurse provide? Reduce sodium intake, consume a high-protein diet. Monitor daily weight, use diuretics as prescribed. Reducing sodium intake, monitoring weight, and using diuretics help manage nephrotic syndrome. A patient with hyperparathyroidism is being treated. What interventions should the nurse implement? Restrict calcium intake. Monitor for kidney stones. Encourage weight-bearing exercise. Provide intravenous fluids as needed. Restricting calcium intake, monitoring for kidney stones, and providing intravenous fluids as needed help manage hyperparathyroidism. A patient with gastroesophageal reflux disease GERD is asking about lifestyle changes. What should the nurse recommend? Avoid lying down immediately after eating. Elevate the head of the bed while sleeping. Avoid spicy foods. Increase alcohol intake. Avoiding lying down after eating, elevating the head of the bed, and avoiding spicy foods help manage GERD. Alcohol intake should be limited. A patient with fibromyalgia is asking about symptom management. What should the nurse recommend? Get regular, restful sleep. Use nonsteroidal anti-inflammatory drugs NSAIDs. Avoid stressors. Increase sugar intake. Getting regular, restful sleep and avoiding stressors can help manage fibromyalgia symptoms. A patient with hemophilia is receiving care. What precautions should the nurse recommend? Engage in contact sports. Use a soft toothbrush for oral care. Monitor for signs of bleeding. Avoid aspirin and NSAIDs. Using a soft toothbrush, monitoring for bleeding, and avoiding aspirin and NSAIDs help manage hemophilia and prevent complications. A patient with eczema is asking about symptom management. What should the nurse recommend? Use scented soaps and lotions. Avoid scratching the skin. Apply moisturizer regularly. Wear cotton clothing. Avoiding scratching, applying moisturizer, and wearing cotton clothing can help manage eczema symptoms. A patient undergoing chemotherapy for colon cancer is experiencing diarrhea. What interventions should the nurse implement? Provide antidiarrheal medications. Increase intake of clear fluids, avoid high-fiber foods. Encourage consumption of spicy foods. Increasing intake of clear fluids and avoiding high-fiber foods help manage chemotherapy-induced diarrhea. A patient with a history of stroke is being discharged. What teaching points should the nurse include? Take prescribed antiplatelet medication, follow a heart-healthy diet. Monitor for changes in vision or speech, increase intake of salt. Taking antiplatelet medication, following a heart-healthy diet, and monitoring for changes in vision or speech help prevent future strokes and manage risk factors. A patient with peripheral vascular disease (PVD) is receiving education. What interventions should the nurse recommend? Exercise regularly. Wear compression stockings as prescribed. Avoid crossing the legs, increase caffeine intake. Exercising regularly, wearing compression stockings, and avoiding crossing the legs help improve circulation and manage PVD. Increasing caffeine intake is not recommended. A patient with pneumonia is receiving treatment. What interventions should the nurse implement? Administer antibiotics as prescribed. Encourage coughing and deep breathing exercises. Monitor oxygen saturation. Provide cold therapy. Administering antibiotics, encouraging coughing and deep breathing, and monitoring oxygen saturation help manage pneumonia and improve respiratory function. A patient with polycystic kidney disease (PKD) is asking about ways to manage symptoms. What should the nurse recommend? Monitor blood pressure regularly. Increase fluid intake. Follow a low-sodium diet. Engage in high-intensity exercise. Monitoring blood pressure, increasing fluid intake, and following a low-sodium diet help manage PKD and reduce complications. A patient with Cushing's syndrome is being assessed. What signs and symptoms should the nurse monitor? Moon face, truncal obesity, hypoglycemia, hyperglycemia. Moon face, truncal obesity, and hyperglycemia are common signs and symptoms of Cushing's syndrome. Hypoglycemia is not typically seen in this condition. A patient with diverticulitis is receiving dietary instructions. What should the nurse include in the teaching? Follow a low-fiber diet during acute episodes. Avoid nuts and seeds. Increase fluid intake. Increase dairy intake. following a low-fiber diet during acute episodes, avoiding nuts and seeds, and increasing fluid intake can help manage diverticulitis. Increasing dairy intake is not typically recommended. A patient with a hip fracture is being discharged. What precautions should the nurse recommend? Avoid crossing the legs, use a raised toilet seat. Maintain weight-bearing restrictions as ordered, engage in high-impact exercise. Avoiding crossing the legs, using a raised toilet seat, and maintaining weight-bearing restrictions help prevent complications and ensure proper healing. A patient with leukemia is receiving chemotherapy. What precautions should the nurse recommend? Practice good hand hygiene, monitor for signs of infection. Avoid large crowds and sick individuals, increase intake of raw foods. Practicing good hand hygiene, monitoring for signs of infection, and avoiding large crowds and sick individuals help protect the patient with leukemia from infections. A patient with a burn injury is receiving care. What interventions should the nurse implement? Monitor for signs of infection. Provide pain management as needed. Apply topical antimicrobial agents. Use a humidifier in the room. Monitoring for infection, providing pain management, and applying topical antimicrobial agents help manage burn injuries and prevent complications. A patient undergoing radiation therapy for lung cancer is experiencing fatigue. What interventions should the nurse recommend? Encourage rest periods throughout the day. Maintain regular sleep patterns, engage in regular exercise as tolerated. Take sedatives before radiation sessions, encouraging rest periods, maintaining sleep patterns, and engaging in regular exercise as tolerated can help manage fatigue related to radiation therapy. Sedatives should not be taken before radiation sessions. A patient with Parkinson's disease is asking about ways to manage symptoms. What should the nurse recommend? Take prescribed medications on time. Use assistive devices for mobility. Engage in regular physical therapy. Consume large meals quickly. Taking medications on time, using assistive devices, and regular physical therapy can help manage Parkinson's symptoms and improve mobility. A patient with coronary artery disease (CAD) is receiving education. What lifestyle changes should the nurse recommend? Follow a heart-healthy diet. Maintain a healthy weight. Quit smoking. Increase saturated fat intake. Following a heart-healthy diet, maintaining a healthy weight, and quitting smoking help manage CAD and improve heart health. A patient with tuberculosis (TB) is receiving treatment. What instructions should the nurse include? Complete the full course of antibiotics. Practice respiratory hygiene. Avoid close contact with others. Increase fluid intake. Completing the full course of antibiotics, practicing respiratory hygiene, avoiding close contact, and increasing fluid intake help manage TB and prevent spread. A patient with kidney stones is being discharged. What instructions should the nurse provide? Increase fluid intake. Avoid foods high in oxalates. Strain urine to catch stones. Avoid hypurine foods. Increasing fluid intake, avoiding high oxalate and hypurine foods, and straining urine can help manage and prevent kidney stones. A patient with hypothyroidism is receiving care. What symptoms should the nurse monitor? Fatigue, weight gain, cold intolerance. Increased heart rate, fatigue, weight gain, and cold intolerance are common symptoms of hypothyroidism. Increased heart rate is a symptom of hyperthyroidism. A patient with inflammatory bowel disease (IBD) is asking about dietary changes. What should the nurse recommend? Follow a low-residue diet. Avoid high-fiber foods. Eat small, frequent meals. Limit hydration. Following a low-residue diet, avoiding high-fiber foods, and eating small, frequent meals can help manage IBD and reduce symptoms. A patient with rheumatoid arthritis (RA) is receiving education. What should the nurse include in the teaching? Use assistive devices as needed. Perform range of motion exercises regularly. Apply heat or cold therapy as needed. Avoid regular exercise. Using assistive devices, performing range of motion exercises, and applying heat or cold therapy can help manage RA symptoms. A patient with sickle cell anemia is being treated. What interventions should the nurse implement? Administer oxygen therapy as needed. Provide adequate hydration. Manage pain appropriately. Encourage strenuous exercise. Administering oxygen therapy, providing adequate hydration, and managing pain appropriately can help manage sickle cell anemia symptoms. A patient with psoriasis is asking about ways to manage symptoms. What should the nurse recommend? Use topical corticosteroids as prescribed. Apply moisturizer regularly. Expose affected skin to sunlight. Increase stress levels. Using topical corticosteroids, applying moisturizer, and exposing affected skin to sunlight can help manage psoriasis symptoms. Increasing stress is not recommended. A patient with asthma is receiving discharge instructions. What should the nurse include in the teaching? Use a peak flow meter daily. Carry your rescue inhaler at all times. Monitor for symptoms of infection. Take a daily antihistamine. Using a peak flow meter, carrying a rescue inhaler, and monitoring for infection help manage asthma and prevent exacerbations. A patient with acute kidney injury is receiving care. What interventions should the nurse implement? Monitor intake and output, monitor serum creatinine levels. Encourage high-protein diet, assess for electrolyte imbalances. Monitoring intake and output, serum creatinine, and electrolyte imbalances helps manage acute kidney injury and prevent complications. A patient with hyperthyroidism is receiving treatment. What symptoms should the nurse monitor? Weight loss, increased heart rate, fatigue, cold intolerance. Weight loss, increased heart rate, and fatigue are common symptoms of hyperthyroidism. Cold intolerance is a symptom of hypothyroidism. A patient with irritable bowel syndrome (IBS) is asking about dietary changes. What should the nurse recommend? Increase fiber intake. Avoid high-fat foods. Eat smaller, more frequent meals. Limit fluid intake. Increasing fiber intake, avoiding high-fat foods, and eating smaller, more frequent meals can help manage IBS symptoms. A patient with osteoarthritis is asking about ways to manage symptoms. What should the nurse recommend? Maintain a healthy weight, use heat or cold therapy as needed. Engage in regular, gentle exercise, consume a high-sodium diet. Maintaining a healthy weight using heat or cold therapy and regular exercise can help manage osteoarthritis symptoms. A patient with deep vein thrombosis DVT is being treated with anticoagulants. What precautions should the nurse recommend? Avoid prolonged sitting, use compression stockings. Take prescribed anticoagulants regularly. Avoid leafy green vegetables. Avoiding prolonged sitting, using compression stockings, and taking anticoagulants help manage DVT and prevent further clots. A patient with shingles is receiving care. What interventions should the nurse implement? Administer antiviral medication as prescribed. Use cool compresses on affected areas. Encourage frequent bathing. Provide pain management as needed. Administering antiviral medication, using cool compresses, and providing pain management can help manage shingles symptoms. A patient undergoing radiation therapy for head and neck cancer is experiencing mucositis. What should the nurse recommend? Use a soft toothbrush for oral care. Avoid alcohol-based mouthwashes. Consume soft, non-irritating foods. Drink citrus juices. Using a soft toothbrush, avoiding alcohol-based mouthwashes, and consuming soft foods help manage mucositis and prevent further irritation. A patient with multiple sclerosis (MS) is receiving care. What interventions should the nurse recommend? Encourage regular rest periods, monitor for signs of relapse. Increase intake of dairy products, practice stress management techniques. Encouraging regular rest periods and monitoring for signs of relapse help manage MS. Stress management can also help, while dairy products are not specifically beneficial. A patient with heart failure is asking about dietary changes. What should the nurse recommend? Follow a low-sodium diet, monitor fluid intake. Increase intake of high-fat foods, avoid excessive alcohol consumption. Monitoring fluid intake and avoiding excessive alcohol help manage heart failure. Following a low-sodium diet is also beneficial, but increasing fat intake is not recommended. A patient with asthma is asking about management options. What should the nurse recommend? Use a peak flow meter regularly. Avoid known triggers such as allergens. Increase intake of dairy products. Practice breathing exercises. Using a peak flow meter and avoiding triggers help manage asthma. Breathing exercises may also be beneficial. Dairy intake does not directly impact asthma. A patient with chronic kidney disease (CKD) is being treated. What interventions should the nurse implement? Follow a low-protein diet, monitor for fluid retention. Increase intake of potassium-rich foods. Avoid nonsteroidal anti-inflammatory drugs NSAIDs. Monitoring for fluid retention and avoiding NSAIDs help manage CKD. Protein intake may need to be limited, and potassium intake may need to be adjusted depending on the patient's condition. A patient with diabetes insipidus is being treated. What teaching points should the nurse provide? Increase fluid intake. Take prescribed desmopressin. Monitor for signs of dehydration. Follow a low-sodium diet. Increasing fluid intake, taking desmopressin, and monitoring for dehydration help manage diabetes insipidus. Following a low-sodium diet is also recommended.